Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters. Tonight, the topic of discussion is going to be osteoarthritis of the hip joint. But before we begin, as is customary, we will begin with the tarbiyah. And it's based on Surah An-Nahl, which stipulates Allah enjoins justice and right judgment in all matters and devotion to doing good and generosity towards one's fellow men, and He forbids you indecency, wickedness, and vile conduct about all offenses against the religion, life, personal property, chastity, and health of mind and body. And He exhorts you repeatedly so that you may reflect and be mindful. This verse is a comprehensive divine declaration containing 6 basic principles, 3 positive and 3 negative. Justice is the first important principle mentioned, because if justice is not established in an individual or society, then to expect the other virtues is in vain. Without justice, the other 2 principles, that is devotion to doing good and generosity to fellow men, is not possible. As for the negative principles, indecency is given priority because it is the starting point of all vice. When indecency and illicit sexual relations are prevalent in any society, all other evils appear one after the other and eventually leads the society to ruin. This indecency should never be regarded as unimportant. Wickedness means doing religiously prohibited things in public. Vile conduct varies from wrongdoing to oneself, rebellion against one's parents, revolting against the lawful authority and causing disorder in the society, to rejecting belief in and obedience to God, to Allah subhanahu wa ta'ala. In conclusion, Abdullah ibn Mas'ud pointed out that the verse has such a comprehensive meaning that it almost contains all virtues and vices due to the broad meanings of the concepts used. Please reflect on these verses. Shukran. And as indicated, the focus of our topic of discussion tonight is osteoarthritis of the hip joint. And we have in studio tonight, our guest tonight is Dr. Ebrahim Hoosen, who is a graduate of Wits Medical School and is posted at Charlotte Makeke, and he's a consultant and orthopedic surgeon. Welcome, Dr. Ebrahim Hoosen. Dr. Ebrahim Hoosen, we're talking about osteoarthritis. So what is osteoarthritis?
Osteoarthritis, essentially, if you literally translate it, means inflammation of the bone and the joint. Essentially, what it means is that there's a breakdown on the articular cartilage of the bone. The joints most commonly involved are the hands, the thumb, the knees, the hips, and the upper and lower back. This is the most common type of arthritis seen. It's more common than rheumatoid arthritis. But unlike rheumatoid arthritis, osteoarthritis only affects the joint itself. It does not affect the skin, the eyes, the blood, or the blood vessels, or the lungs.
And where is the hip joint? If you can tell us, we're talking about the hip joint, but where specifically is the hip joint located?
So the hip joint is made up of the femur and the acetabulum. And if you're looking at the first slide that we have, the femur is the thigh bone, and it has the head section as demonstrated in this. And what we have here, this is the thigh bone, and this is the pelvis. And this area here where the head of the femur and the acetabulum articulate with each other is called the hip joint. And this hip joint is prevented from touching each other by cartilage. Now, cartilage is a hard and slippery tissue. It allows the bone to glide over one another and acts as a shock absorber. So in this picture that we're showing on the screen, the cartilage is demonstrated with glue. In osteoarthritis, the surface layer of this cartilage breaks down and wears away. And the bone under the cartilage rubs against each other, causing pain. And over time, the joint may lose its normal shape, and the small deposits of bone may grow on the edges called osteophytes. And essentially, this breaking down of the bone results in pain and further damage to the joint. In the next slide that we have, it's a picture that we have from a patient taken intraoperatively. And what we're trying to show you is that it's the head of the femur, and the areas where it's red and irregular, that's the area where the cartilage has eroded and worn away. And the area where it's white or creamy color, that's the area where the cartilage is still present. So essentially, osteoarthritis has taken place in this femoral head.
So am I correct in understanding you saying that it's wear and tear? The osteoarthritis is actually the wear and tear of the hip joint over a period of time.
That's correct. Osteoarthritis, as we mentioned, is a wearing away of the cartilage, and as the cartilage wears away, the bones now start rubbing against each other, causing friction, and this ultimately causes pain to the patient.
And is this pain something that becomes unbearable and affects the patient's well-being and daily functioning?
So osteoarthritis, different people react differently to osteoarthritis. It's a gradual onset. For some people, it affects them over a prolonged period. Some people, it affects them over a short acute time period. And different people have different pain intensities depending on the grade of osteoarthritis. The earlier patients may have minimal pain, and the more progressive the arthritis becomes, the more severe the pain becomes, up to a level where the patient's daily activities are affected. The patient may not be able to sleep at night.
Okay, so it does affect their daily functioning and well-being. Who are the people that actually get osteoarthritis? Is there a specific population or group of people that are affected by osteoarthritis?
You know, sometimes osteoarthritis is called a degenerative joint disease. So essentially, patients who are over the age of 45 are more prone to getting osteoarthritis. It can happen at the younger age group, but more so in people over the age of 45. Osteoarthritis, we classify it as primary osteoarthritis or secondary osteoarthritis. And patients who don't have an underlying cause or there's no predisposing factor, that patient has a primary osteoarthritis. Where there's a known cause, that patient will be classified as a secondary osteoarthritis. And the risk factors that have been mentioned are people who are overweight, in other words, increased body mass index, they're obese patients, patients who have increasing age, also people who have specific occupations, such as people working with jackhammers. The repetitive stress can cause osteoarthritis, coal miners, also construction workers, people who are bending down can get osteoarthritis of the knees. Other causes are people who have had trauma to the hip joint, and that affects the cartilage or destroys the cartilage, and these people are prone to osteoarthritis.
So when you say trauma to the hip joint, what are some of the traumas that people are exposed to that will affect the hip area?
So trauma that we're referring to is simple things such as a fracture to the head of the femur. Patient may be involved in a motor vehicle accident, have a dashboard injury, the acetabulum or the cup of the pelvis gets injured and the cartilage gets injured, and this patient later on in life can develop osteoarthritis. Other trauma is a patient may have dislocated the hip, and during the reduction the cartilage may be affected, and this patient may also be prone to osteoarthritis. The other causes of osteoarthritis may include people who have avascular necrosis. By avascular necrosis, we mean that the head of the femur, the blood supply to that femur has been disrupted, and the blood supply, because it's been affected, the patient, the head of the femur is now they're not getting a blood supply and becomes necrotic and it dies off. And there are certain groups of people who are more prone to getting avascular necrosis, And among them are people who are alcoholics, who use alcohol on a daily basis, people who are on steroids, people who are on HIV or ARV treatment, and people who are exposed to radiation. The slide that we got presently shown there is on a picture with a patient with osteoarthritis on the left hip joint and a patient without osteoarthritis. And what one notices here is that on the side without osteoarthritis, there's a nice space between the cupped acetabulum and the femoral head. And on the side with the osteoarthritis, there's no space, there's no hip joint per se, and the bones are now touching each other.
Okay, interesting, very fascinating. Dr. Ebrahim, you mentioned necrosis and you said becoming necrotic. In layman's terms, are we talking about it like basically rotting? Is that what you're saying?
The easy way to explain it, yes, that's correct. The bone becomes dead because of the decrease in blood supply to the femoral head. There's no blood supply going all the way to the femoral head. The cells are not oxygenated and the bone dies off. And when this bone dies off, the cartilage dies off as well, and they then get osteoarthritis where the bone now starts rubbing against each other and the protective layer of the cartilage is not there anymore. One must remember that cartilage is a slippery and hard tissue, and the function of cartilage is to allow the bones to glide over one another, and it acts as a shock absorber. And when this cartilage breaks down, the bones are now starting to rub against each other.
Okay. And what other symptoms are manifested by a patient that has osteoarthritis of the hip joint, apart from the pain that you have described earlier?
So as Dr. Umar, have you rightly mentioned, pain is the most prominent feature and most common complaint of osteoarthritis. And this pain here most commonly occurs after motion, and it resolves with rest. The patient may also complain of stiffness in the joint itself, but this stiffness usually lasts less than 20 minutes. This stiffness usually lasts less than 20 minutes. And as the disease progresses, patient may have a decreased range of motion of the joint and increased pain with the motion.
So you say that eventually the pain does subside. You described a period of 20 minutes, well, an average period of 20 minutes, and the patient is then able to move again,
yes.
Mobilize.
Yes. The difference between osteoarthritis and rheumatoid arthritis regarding the pain or the stiffness itself is that with osteoarthritis, the pain usually is less than 20 minutes. And it said that with rheumatoid arthritis, the pain usually lasts for more than an hour in the mornings.
Okay, we are ready to take an ad break, and on our return, we will continue with osteoarthritis in the hip joint. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters. For those of you that have just tuned in, our guest in studio tonight is Dr. Ebrahim Hoosen, an orthopedic consultant at Charlotte Makeke Hospital, and the focus of his topic is on osteoarthritis of the hip joint. Dr. Hoosen, you mentioned earlier about the ages of people that are more likely to be inflicted with osteoarthritis of the hip joint. You mentioned above the age of 45. However, you also alluded to the fact that people under the age of 45 could also be at risk. Could you speak a little bit more to that, please?
That's correct. Osteoarthritis, as we mentioned, is a degenerative joint disease. In other words, the cartilage wears out as the patient gets older. In the patient that's older than 45, this is more common in males. But in patients who are younger than 45, it's more common in females. But the patient who gets an osteoarthritis below the age of 45, there are certain groups of people who may be predisposed to osteoarthritis. And amongst them is someone who has had a dysplastic hip. So what that means is that the cup of that pelvis or the acetabulum is shallow. The femur head does not sit well or adequately within that acetabulum, and that's when the patient may develop an osteoarthritis. Also, patients who are exposed to trauma or the cartilage is damaged at a young age, they may develop osteoarthritis at an age less than 45 years of age.
Okay, so there are cases where under the age of 45.
And in South Africa, a big problem, or what we find emerging recently, is because of the HIV condition and patients taking ARVs, that we are now getting patients who are younger than 45 presenting with osteoarthritis.
So how does one actually diagnose osteoarthritis of the hip joint? What does one look out for? What does one need to look out for?
So, as we mentioned, that pain is the most common symptom that patients may present. They may also present with a decreased range of movement, where the hip is stiff. They may also complain that they are not walking properly. They have difficulty in walking, what we call an antalgic gait. The other things that the doctor or orthopedic surgeon may want to ask the patient is, how are the activities of daily living being affected? Such as, how far can they walk before they have pain? Are they using a walking aid? Do they need to walk up and down and stairs using holding the railing? Can they do their own shoes or socks? Is they have difficulty getting into and out of the bath? And as well as sitting in a car, do they prefer the front seat? Or if they're using a taxi, do they prefer to sit just behind the driver or sit in the front seat? This allows them to stretch their legs. So those kind of things are from the history, that's what we're looking at. From an examination point of view, we examine to see what's the range of movement of the patient. Is there a decreased range of movement? Is it causing the patient any pain? And then further tests that we do are x-rays. So x-rays essentially will show us whether the hip joint is affected, whether there's a decrease in the joint space, what we call bone spurs or osteophytes, and also if there's any increased density or sclerosis within that joint itself. Regarding blood tests, there's no blood test that can confirm osteoarthritis. Sometimes doctors do blood tests, but the blood test is more to exclude other conditions such as rheumatoid arthritis or other medical conditions.
You mentioned something about, I think you used a medical term again, and I don't know if people actually understood that. You said, not degeneration, but there was something else, but perhaps we can just pick up on that later on.
Okay, sure.
In diagnosis, you also said about, I was just wondering, about people preferring to sit or leaning against something, having difficulty. Would that be one of the symptoms? Yeah.
So with activities of daily living, this gives us an idea of how badly the patient's daily activities, daily functioning has been affected. And the one thing that we do ask patients is, do they prefer to use a high chair or a low chair?
Okay.
And we find that patients with osteoarthritis tend to use a higher chair. It's easier to get off the chair when you're trying to get up the chair, or even to sit down. And regarding the walking aid, we ask them if they're using a crutch or they're using a walking frame, because all of these kind of things, it tells us that the patient's activities of daily living have been severely hampered.
So how would you actually manage osteoarthritis of the hip joint?
As osteoarthritis, the goals of treatment is to relieve the pain, to maintain the range of movement, to maintain a healthy lifestyle, and also to maintain a body weight. And the way we normally break it down is conservative management and surgical management. And it depends on where the patient is presenting. Is he presenting early on in the disease or late in the disease process, where it's gone so severe that he is now at a grade 4 pain, in other words, pain that keeps him awake at night, and his activities of daily living have been affected. So conservatively, the things that we do start off with is, what we do encourage is exercises. And by exercises, we want patients to do a strengthening of the muscles, to maintain a range of movement, and also to do aerobic exercises. Exercises such as swimming or walking, or non-impact exercises. In other words, not running, but more swimming and walking exercises. We find that exercises really helps the patient. Another important thing in conservative management is weight control. And it has been shown that losing weight really can make a difference with patients' osteoarthritis. And patients who are already overweight, those patients, it has been shown that it may prevent them from developing osteoarthritis. Again, going further on in treatment of osteoarthritis, we then can go on to analgesia or medication. And what we generally do start off with is with paracetamol or acetaminophen, commonly known as Panado, if that doesn't help, and then we can go on to the more stronger medication.
So you're saying starting off with the paracetamol, the analgesics, and then you would move on to more stronger. Are you referring to your anti-inflammatories?
That's correct.
And
So the types of medication we can go on after that, they go to non-steroidal anti-inflammatory drugs. But one must remember that there are risks with using non-steroidal anti-inflammatory drugs. It's more important that you discuss this with the patient. The patient discusses this with the doctor that's been treating him for this year. Patients, what we do find, are prone to going to the chemist to get over-the-counter medication, and that's something that we're not encouraging. We prefer the patient discusses medications with the doctor, especially if you have comorbidities, things such as high blood pressure, diabetes, ulcers, those kind of things. It's more important to discuss them with either your general practitioner or your orthopedic surgeon.
Now, you mentioned, obviously consultation and having regular consultation with a doctor and not just buying off the counter. What are some of the side effects if taken over a lengthy period of time, taking anti-inflammatories over a lengthy period of time? What are the risk factors and side effects that could affect a patient? So
the things that we need to worry about is, we talk about anti-inflammatories such as your Brufens, your grandpas, aspirin. What we concern about, if these medications are not used at the correct manner, patient may be prone to ulcers, patient may also develop a renal failure. Also, cardiac patients need to be careful when using these anti-inflammatory drugs. That's why we always suggest discuss this with your personal doctor before embarking on using analgesia, such as non-steroidals.
So obviously one needs to have, as we mentioned earlier, consultation with the doctor regularly and be aware of the risk factors and side effects of long-term medication.
Correct.
We are ready to take an ad break, and after the ad break we will resume with the topic on osteoarthritis of the hip joint. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters. Our guest in studio tonight is Dr. Ebrahim Hoosen, who is talking about osteoarthritis in the hip joint. Dr. Ebrahim, you said the approach to medical intervention is starting conservatively, so starting low, going slow. When is there an indication for surgical intervention?
Generally, we use pain as the yardstick of when we want to operate on a patient. And by pain, we mean that the patient has grade 4 pain. What that means in simple terms is that a patient is on adequate analgesia, and despite the adequate analgesia, the patient still stays awake at night, or the patient gets awakened up because of the pain. That's the one criteria. The second criteria is how badly is this patient's daily activities are affected. And we alluded to this earlier on when we said, how far does the patient walk before he has pain? Does he require walking aid? Does he require a high chair or a low chair? Does he require to sit in the front of the car or the back of the car because of the leg room? And can he put on his own socks and shoes? And does he have difficulty even taking a bath or getting in and out of the bath? So those kind of questions we ask the patient, and it gives us an idea that, look, the patient's activities of daily living have been severely affected. The pain is quite severe. It's not being under control with analgesia. It's now when we can decide to offer the patient surgical intervention.
I would just like to announce to the viewers to please feel free to call in to ask your questions on 011 086 7700. Please look on the screen. The number is there. Feel free to contact Dr. Ebrahim Hoosen to ask any questions or concerns that you may have. So you were speaking about the surgical intervention and indication for when surgery should be performed, and you've described that the patient is usually debilitated, but it seems like it would also affect the patient emotionally and psychologically. Would that also contribute to an indication to perform surgery?
Yes, we do take into account all of that as well, because as we know, with osteoarthritis, with severe osteoarthritis, patients may have difficulty getting employment or continuing with their work. And as we know, if a person is unable to do their work, they may be retrenched or laid off from work. So those kind of things we do take into account to get the patient back as functional as possible.
What is hip replacement entail? I mean, the whole procedure. If you can speak a little bit more to that and explain the whole process of undergoing such a surgical procedure.
So, as I've mentioned earlier, that this is a pelvis. This is the pelvis. This is the acetabulum or the cup, and this is the femoral head. And this here forms the hip joint. This moving here forms the hip joint. With osteoarthritis of the hip joint, the bone of the femur and the acetabulum now rub against each other, and any movement causes pain. When the patient either gets up or walks, any movement causes pain. So with the hip joint, for an osteoarthritis, one of the procedures that we can offer the patient, depending if the patient is fit and healthy for surgery, is a total hip arthroplasty or total hip replacement. And what we do in a total hip replacement is that we replace the acetabulum, the cup, we put in a new implant in the acetabulum, and we cut off the head of the femur, the neck of the femur, and we put in a new metal head and stem. And what we do by that there is, can just show to the viewers, is that we have, this is showing a patient who's got a hip replacement. And here, in this specimen, we can see that, I hope it's projecting quite clear there, that the patient has a new head, a neck, and a stem, and a new cup. And to give a better idea of what this actually looks like, is I have here an implant. So this here is what fits into the pelvis or to the cup side of the hip joint. It's a metal with a polyethylene liner, or plastic type of a liner. That's the white part there. And this is the stem. This is what goes into the thigh bone. And this is the stem with the neck area as well. And onto the neck, we attach a metal head or sometimes a ceramic head. And that fits into the stem. And when we reduce this hip or put this hip back into its correct position, we have something like this here, where we have a hip, and this essentially is the hip replacement, where you have the cup, the polyethylene liner or a plastic liner, could be a ceramic liner, and also the head with the stem as well.
We have a caller on the line. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.
Sister, how can Dr. Ebrahim help you?
I just wanted to know about this hip business. My legs, my right and left, but sometimes it's more my left and sometimes it's my right. But inside the groin, I always get sharp pains. Is it a cause of the arthritis?
Pain around the hip joint could be in one of three areas. It could be in the groin, as you mentioned, which is anteriorly or in the front. It could be laterally or in the side, or it could be posteriorly. Yes, specifically, the caller says that the pain is in the groin area, and that suggests to us that there's some kind of pathology or something that's causing the pain that's within the hip joint itself. So it is possible that the problem is in the hip joint. A few questions we need to know is, how old is the sister?
I'm 70.
70. And I've mentioned activities of daily living. Are these being affected in any way? In other words, your walking distance is decreased, you're using any walking aid, and you have difficulty walking up and down stairs?
Well, up and down a little bit, and not walking with a stick.
I see.
Yeah, but it's more and just sudden pain I get for about a few minutes, few seconds, and sometimes 5 minutes, and then it disappears.
Ideally, it would be nice to examine the hip to see whether there's any crepitus or any grinding of the hip that's causing the pain, or any other problem that's causing the pain. Also, one must think of if there's any pain in the side, or that could be from the trochanter, or if there's any pain that comes from the back, because sometimes you do have pain from the back that causes you to have pain around the hip joint as well.
Okay, no, I'm not too sure of the back, but more it's on my leg.
Yes. Does the pain go down to the knees?
The inside of the groin more.
Yes. Does there any pain in the knee itself?
Knee, yes. Now and then, yeah. I do get pain in the knee.
Because
and like getting out of the car and getting in the car is a bit of a difficulty. And I do sit on I prefer a higher chair than lower chair.
Yes, I would think that ideally you'd have to be examined, because what could happen is sometimes you do have pain referred from the knee going to the hip joint as well. So ideally it would be nice to have the knee examined and your hip joint examined, and if further investigations are required, such as an x-ray of the hip or the knee, that would help us in giving you a diagnosis of where we stand.
So where are you situated?
As mentioned earlier, Dr. Hoosen is based at the hospital. He's a consultant at Charlotte Makeke.
Where's that?
The Johannesburg Hospital. But
okay.
Currently he's based at Chris Hani Hospital. He will be at Charlotte Makeke from the 1st of November. So he's working for the state.
Oh, okay. So I've got to go there.
You can go wherever you like, actually. You can choose. But I think the important message for you to understand is that you need to seek medical attention. You actually need to see your doctor first.
Okay. Jazakallah.
Jazakallah. Assalamu alaikum wa rahmatullahi wa barakatuh. Dr. Hoosen, I think just speaking about, like this patient mentioned, what advice would you give to people out there in terms of prevention? How can people address this? Because it's obviously quite an important thing, the hip joint. How can they prevent it from developing into osteoarthritis?
I think the one thing that we can stress about is that research has shown that losing weight is one thing that can reduce the risk of osteoarthritis. Obviously, if a patient has had trauma and the cartilage has been affected, there's not much you can do about that. You will be prone to getting osteoarthritis at a later stage. But as I mentioned, losing weight, that has been shown in many journal articles that it can reduce the risk of osteoarthritis. Also, if the patient undergoes or does regular exercises, staying active, doing aerobic exercises, the exercises that we mentioned, non-impact exercises, those are things that will benefit a patient who has been diagnosed with osteoarthritis.
And does diet help in any way? Following a specific diet and taking vitamins? Often people believe taking vitamins could prevent it or assist osteoarthritis from becoming more serious.
There's no specific diet that we would recommend for osteoarthritis. With diet, we would suggest that having a healthy diet, because that will assist you in weight loss or maintaining a healthy lifestyle. Regarding, I assume, Dr. Umar, you're referring to nutritional supplements.
Yes, indeed.
And the nutritional supplements that a lot of patients have been asking us about is this chondroitin glucosamine. Does that help with the cartilage and that there? And it depends on which journals you read, because some of the journals have said these supplements have the potential for reducing pain. But there's no level 1 evidence, or there's no conclusive proof that has emerged to show that these supplements actually help. But if you look at another study, it's a study that was done in the United States over 4 years. 16 states were part of the study, and they found that the majority of the patients, there was no real difference in the pain, but there was a small subgroup of people who had significant pain relief for the moderate to severe osteoarthritis. So presently we're uncertain. There's no firm conclusive evidence to say that this does help, but there are studies undergoing presently, and we hope to see in the future that published data to show us that either this is beneficial or not beneficial.
Okay, we have a caller on the line. Assalamu alaikum wa rahmatullahi wa barakatuh. Oh, unfortunately, the caller's hung up. We will then take a short ad break, and on our return, continue with osteoarthritis of the hip joint. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters. Our guest in studio tonight is Dr. Ebrahim Hoosen, an orthopedic surgeon who is a consultant at Charlotte Makeke. Dr. Ebrahim, you spoke a lot. I think we'll just hold on to that for now. We have a call on the line. Assalamu alaikum.
Wa alaikum salam.
Brother, how can Dr. Ebrahim Hoosen help you?
Sure. Dr. Hoosen, I had an operation at Mill Park about 8 weeks ago. I'm quite old. I'm about 68. My problem is, I have many complications following the operation. I can barely walk. I have a urinary problem after the operation. And things are not working in the bedroom also. It's very difficult. And these are things that, the surgeon didn't explain to me. I had, a surgeon from Pakistan who did the operation. And really, I'm very disappointed with the result. I went back to him, and he just he laughed at my face. He's causing problems in my marriage. I don't know how to take it further. Do you find these complications after the operation?
I think your problem is probably twofold. Yeah, more a urological problem as well as an orthopedic problem. I'm not quite sure whether your problem is more urological or orthopedic. Obviously, we need to discuss it personally with your orthopedic surgeon and take it forward from there. If it's the hip joint that is the problem, then we need to look at what's still causing the pain. 6 weeks after the operation, one may still experience pain after the hip operation. The other thing to consider is if you're having urological problems, then I would suggest that maybe you discuss it with your orthopedic surgeon again, and he could probably refer you to a urologist to consult you and to assist you with that.
Yeah, he has referred me to the professor there, Professor Hafaji, urologist. So inshallah, I see him next week, and maybe things will get better.
Inshallah.
Ameen.
Inshallah.
Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh. Interestingly enough, that he mentioned complications which you were going to touch on anyway. So perhaps if you can elaborate on the complications after, the possible complications after, in hip joint operation or surgical procedure. What are some of the complications that one needs to look out for?
One must remember that a total hip replacement or total hip arthroplasty is major surgery. It's a big operation, and with any operation, there are always risks and benefits. So the risk or the complications that one can experience is, as with any operation, there's an infection that could occur. The other things is the patient may dislocate the hip. So that's why your doctor will advise you prior to the operation what can be done, what shouldn't be done, especially when trying to pick up things from the floor and sleeping and crossing over of legs, things that are not allowed and what is allowed. The doctor would also refer you to physiotherapy, and they would assist you in mobilizing. The other complications that one could get is deep vein thrombosis or clots in the leg after the operation.
So can that be addressed?
Deep vein thrombosis or clots in the leg is a risk after the hip operation or hip arthroplasty, and orthopedic surgeons generally do give medication to prevent this here. They could either give you an injectable, something that you give subcutaneously to prevent blood clots, or now with the newer medication, we can give an oral anticoagulant, which we give for approximately 5 weeks, and this will prevent blood clots, which can cause fatal complications such as a pulmonary embolus.
Okay, we have another caller on the line. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.
Sister, how can Dr. Ebrahim help you?
I would like to know, that I've been diagnosed with osteoarthritis.
Gee.
I've been diagnosed. I've just been to hospital today, and it was confirmed that I have got that. But is it only in the hip, or can it be in the spine as well?
Osteoarthritis, the common sites of osteoarthritis, as we mentioned, are the fingers, the thumbs, the upper spine and the lower spine, meaning the cervical spine and the lumbar spine, as well as the hip and the knees. So it is possible to have osteoarthritis in the lumbar spine. Are your symptoms more in the groin or more in the buttock area?
It's in the lower spine.
So it is possible that you may have osteoarthritis of the lower spine, which is a common area as well.
Yes, and does it also affect your leg, like as the other caller was telling us just now?
That's correct.
Yes.
What you could have is you could have pain that radiates down your leg, and that pain generally would go all the way, depending on where the osteoarthritis is in the back, it could cause pain all the way down to your toes.
Yes, it does, and it gives my toes like pins and needles.
Correct. So what that suggests to us that you may have spinal stenosis. In other words, the spinal cord in the lumbar spine area, that means the lower back area, is getting compressed, and that's probably because of the arthritis or a disc prolapse. What I suggest you do there is you need to be seen by an orthopedic surgeon or a spine surgeon, and they would give you, assist you more there in the way forward. Obviously, we could try to start off with conservative management and then go on to surgical management. Just as a caller, just as now that you're mentioning that you have a back problem, generally with the hip problem, the pain, if it radiates down the leg, does not go further than the knee or does not go further than the calf. It stays above that level if it's a hip joint problem. But if it's a back problem or lower back problem, that pain can radiate all the way down to your toes.
Yes, it is definitely a back problem because just today it was again confirmed that I have got osteoarthritis in my lower spine.
Gee.
And I was just given some medication, and well, I don't know, for the first time when I had all this medication, it helped me.
Yes.
I don't know, because I got some more medication. Do I have to carry on with it, or do I have to see a doctor again? Because just what you told me now, doctor, is that I have to see an orthopedic surgeon.
See, the reason I'm saying that you need to see an orthopedic surgeon or a spine surgeon is because what the back problem is, if you had done an X-ray on the general South African population, a lot of people would have X-ray changes suggestive of osteoarthritis, but it does not necessarily mean that we need to do something about that. So when a doctor examines you, he's going to get a proper history, get more detailed history, and check for any neurology, if there's any loss of sensation, any loss of power in the lower limbs, and then depending on that, then he'll decide, look, we're at a stage where we need to do something because this condition is going to deteriorate.
Well, we see, yeah, you see, I have taken X-rays.
Yes.
The X-rays show that the vertebra at the bottom, the 3, 1, I don't know what you call it, but it says 1, 2, and 3.
Correct.
The space in between
Yes.
is narrowing.
That's correct.
And this is why when I go there, I just get more medication instead. I was supposed to see another surgeon, an orthopedic surgeon today.
Yes.
But the doctor who saw me just gave me more medication.
Look, I think the correct thing is would be nice to see an orthopedic surgeon or a spine surgeon. The reason I say this here is because they would want to examine your lower limbs to see if there's any neurology, and that would help in deciding the way forward. It's difficult just to say what should be done without physically examining you to see what is your function and neurology regarding motor and sensory in the lower limbs.
Shukran, doctor. I'm satisfied with your advice.
Pleasure.
Do I have to see? Pardon?
I think that's correct. As you say, you have an appointment with the orthopedic surgeon. I would suggest you continue with that appointment.
Pardon? I didn't get that.
I would say that you say that you have an appointment with the orthopedic surgeon. I would suggest that you continue seeing that orthopedic surgeon.
Okay. Shukran, doctor.
Pleasure.
Shukran. Assalamu alaikum wa rahmatullahi wa barakatuh. We're coming to the end of the show. So what message would you like to give the viewers out there, Dr. Ebrahim?
I think a person who's diagnosed with osteoarthritis, they should have a balanced, comprehensive approach. And the key is to stay active and healthy with the disease. Have a positive mindset. The patient should try and combine exercises, education, social support, and discuss with the doctor different strategies of pain control. And inshallah, with this year, the patient will be able to live with the condition. And inshallah, if it comes to a stage where you need to do a hip replacement, the indication will be for the right reasons.
Inshallah. Shukran for that most informative and interesting discussion on osteoarthritis of the hip joint. As is customary, we will end with a recitation from the Holy Quran. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. صدق الله العظيم. And we will continue with health matters next Tuesday. Assalamu alaikum wa rahmatullahi wa barakatuh. Bye.